When someone gets a cancer diagnosis, one of the biggest, scariest unknowns is what happens next? Will this treatment work? Is the cancer going to come back? For years, doctors have been trying to answer these questions, but honestly, it's often like trying to predict a hurricane with only half the data. But what if you could combine different kinds of forecasts to get a much, much clearer picture? Well, that's exactly what one incredible new study decided to find out. Okay, so let's just put ourselves in the room for a second. Imagine you're an oncologist, and a patient is sitting right there in front of you. Their entire treatment plan, their quality of life, really, their chances of survival, it all comes down to how well you can predict what their specific tumor is going to do. Is it going to respond to chemo? Will it pop up again after surgery? I mean, these are the questions that keep doctors up at night. And look, this isn't just some academic thought experiment. This is the absolute heart of personalized medicine. If you guess wrong, the consequences are serious. Choose a treatment that's not aggressive enough for a high-risk patient, and you might miss a crucial window. But on the flip side, give someone super harsh chemo that they don't actually need, you're just causing harm for no reason. We absolutely need a better crystal ball. So, to build that better crystal ball, these researchers took a really cool approach. They decided to tackle the problem like a detective solving a really tough case. They figured to truly understand the suspect, in this case the tumor, you can't just rely on one piece of evidence. You need to combine two very different kinds of clues: the big sweeping overview and the tiny microscopic details. Okay, so the first piece of evidence, it's a field called radiomics. The best way to think about it is like an aerial photo of a crime scene. A powerful computer algorithm scans a patient's CT scan and pulls out literally thousands of features. Subtle patterns, textures, shapes, things that are totally invisible to the naked human eye. It's that big picture view, the lay of the land. And then you've got the second piece of evidence, pathomics. Now this is where we zoom way in. This is the detailed forensic analysis. It's like taking a tiny tissue sample from the tumor, putting it under a microscope, and having an AI analyze the super intricate patterns of the cancer cells themselves. This is the close-up clue, the fingerprint left at the scene. And this, right here, is the core idea of the whole study. See, for a long time, we've used these two types of clues separately. The radiologist looks at the big scan, the pathologist looks at the tiny slide. But this research asked a really simple but powerful question. What happens if we give both sets of clues to a single AI detective? And that's exactly what they did. They built what they call a radiopathomic fusion model. This AI was trained to look at both the crime scene photo from the radiomics and the microscopic fingerprint from the pathomics, all at the same time. It learned how they connect to predict what the tumor is going to do next. So the big question is, did it actually work? All right, so the researchers put their AI detective to the ultimate test. They didn't just test it once. They threw 3 completely different high-stakes scenarios at it. These are the real-world challenges that doctors are grappling with every single day. First up, a group of 193 patients with early-stage lung cancer. They've all had surgery to remove the tumor, but the huge question mark is, for whom is the cancer likely to come back? This is so critical because it helps doctors decide who might need that extra round of chemo, just in case. And the results were, well, they were pretty amazing. As you can see here, the combined fusion model was way better at predicting recurrence than using just the CT scans or just the pathology slides alone. It got a C-index of 0.71. Just think of that as a score where 0.5 is a total coin toss and 1.0 is perfect prediction. So this was a huge win. But there's one number in particular that really shows its power. Get this. A hazard ratio of 8.35. What does that even mean? In plain English, it means that the patients the model flagged as high risk were over 8 times more likely to have their cancer come back than the patients it flagged as low risk. That's not just a small improvement, that is a massive, game-changing leap in our ability to see the future. All right, case number 2. Now we're looking at patients with advanced lung cancer who are getting immunotherapy. This is that revolutionary treatment that helps your own immune system fight the cancer. The only catch is it doesn't work for everybody. So can the model figure out who it's actually going to help? And you guessed it, the same pattern emerged. The Fusion model, our combined AI detective, scored an AUC of 0.75. That's another accuracy score, kind of like the C index. And again, it blew the single data models out of the water. It was just a much, much sharper tool for picking the winners. For the final showdown, the researchers took on a totally different beast: small cell lung cancer. This is a really aggressive form of the disease. And here, the question was all about predicting who would respond to good old-fashioned chemotherapy. And this last test just sealed the deal. Even with this super aggressive cancer, the Fusion model came out on top again, with a really impressive score of 0.78. The message was loud and clear. Across 3 different types of cancer and 3 different treatment questions, combining the clues was, without a doubt, the winning strategy. Okay, so this all sounds amazing, right? A true game changer. And in science, there's always a but. We have to keep our feet on the ground. This is still early stage research, and just like any good detective story, we've got some really promising leads, but there are also some real-world hurdles to jump over before this thing shows up at your local clinic. So let's just break it down. On one hand, the promise here is huge. We're talking about better predictions, a tool that could work for lots of different cancers, and an AI that doctors can actually understand, not just some mysterious black box. But the hurdles are just as real. This study was retrospective, meaning it looked back at old data from a pretty small group of patients. To really prove itself, it needs to be tested in big, forward-looking trials. And then there's the giant logistical headache of getting every hospital everywhere to prepare their scans and slides in the exact same way. So that leads to the million-dollar question, right? What's the roadmap here? How do we take this brilliant research from a paper and turn it into a tool that's actually helping patients? How do we get this AI detective on the case in clinics all over the world? Well, the path forward is actually pretty clear. Step 1, and this is the big one, is you have to validate it in larger trials across many different hospitals. Then you can make the model even smarter. Why stop with just 2 clues? The next logical step is to start feeding it more data, like the tumor's genetic info. I mean, imagine adding DNA evidence to the crime scene photo and the fingerprint. To make it practical for daily use, you've got to automate the whole process. And if all that works, you can expand this whole idea beyond lung cancer to fight other tumors, like breast and colorectal cancer. And that really leaves us with a final big thought to chew on. We all dream of that one miracle cure for cancer, right? That one magic bullet. But maybe the real revolution isn't a single cure at all. Maybe it's the power of putting all the pieces together, of combining every clue we have, from the big picture scan to the microscopic cell to the genetic code, to finally see the full picture and make the absolute smartest decision for every single person.